Influenza cases were more frequently tied to a number of post-infection neurological conditions including neuropathy, migraines and epilepsy than an infection of COVID-19, according to a new study of more than 150,000 patients published by Neurology, the medical journal of the American Academy of Neurology. While the results were not what we expected to find, they are reassuring in that we found being hospitalized with COVID did not lead to more care for common neurologic conditions when compared to being hospitalized with influenza, Brian Callaghan, one of the study's authors, said in a statement. The study did not look at the outcomes of long COVID infections, which have often been blamed for the most extreme lingering symptoms. Other studies have shown patients with long COVID, defined as an infection still displaying new or continuous symptoms after 3 months, can experience nervous system disruption including loss of coordination, tremors and sudden muscle twitching. Fatigue, headache and brain fog are the most common neurologic symptoms of long COVID, according to the American Medical Association. Between the first confirmed case of COVID-19 in January of 2020 and April of 2022, a majority of Americans are thought to have at some point been infected with the coronavirus, according to the Centers for Disease Control and Prevention. As of March 2, almost exactly 4 years from the start of American shutdowns due to the virus, an average of 4,255 people were still being admitted to hospitals daily due to COVID infections, according to the New York Times. On average, 1.3 per every 100,000 Americans are admitted to hospitals for COVID per day, most commonly in Delaware, Missouri and North Carolina. The CDC says there have been almost 280,000 positive flu cases reported between October 1 and March 9, a majority of which were confirmed infections of the influenza A virus. In the week of March 9, the latest data available, there was an average hospital admission rate of 67.9 people per 100,000.774 million. That's how many confirmed cases of COVID-19 there have been around the world as of March 3, according to the World Health Organization. More than 7 million people have died. A study released earlier this month found that COVID lowered the life expectancy of people across the world by 1.6 years between 2019 and 2021. The United States experienced the highest excess mortality rate when compared to similar high-wealth nations. An additional 1.59 per 1,000 people died in 2020 and 2021 than were expected to if not for the COVID-19 pandemic.